My name is April Wayne. I'm a third-year pharmacy student at the VCU School of Pharmacy, and I'm from San Antonio, Texas, where I received my BS in biology at the University of Texas at San Antonio. I made the decision to come to pharmacy school while I was working in a community pharmacy back home. I really enjoyed getting to connect with our patients, but I noticed a gap in important healthcare factors like lack of communication between patient and provider, patients being unaware that they had a choice in their health outcomes, and patients not being adherent to medication because of financial burden. This really fueled my interest in becoming an advocate, an educator, and a resource for patients, and I knew I could achieve this and much more by becoming a pharmacist. I started doing research with Dr. Flurie and Dr. Salgado after talking with Dr. Flurie about her research opportunities and finding some common interests. I was excited to take on one of her projects as part of an independent research elective starting in the summer of 2020. Our research goal was to develop a pharmacist-led anemia management protocol within the Interprofessional Fellows Chronic Kidney Disease Clinic at VCU Health, and we really hoped to lay the groundwork for further implementation of the anemia clinic. The fact that it was difficult to find published materials surrounding this topic showed me that this is an area of practice that can use innovation and diligent effort, and that's something pharmacists are great at. Pharmacists have come a long way. Our scope of practice is continuously evolving, but there are still limitations on what we're allowed to do. This research is important to me because it shows how, under the care of pharmacists, management of medication is optimized and overall patient quality of life and health outcomes are improved. To me, this means that pharmacists bridge an important gap in healthcare, and I'm hopeful that this will contribute to showing what pharmacists are capable of doing and further broaden our scope of practice. Working with Dr. Flurie and Dr. Salgado has been amazing. They are both always so supportive and give great constructive feedback, and honestly, they contributed to me being excited about research. As someone who's interested in becoming a clinical pharmacist, it's important to be comfortable with doing research, as this skill translates to performing literature searches and practicing evidence-based medicine, which pharmacists do regularly. My experience doing research with Dr. Flurie and Dr. Salgado has definitely primed me for a career of lifelong learning and helped cultivate my research abilities. I hope this message helps others get excited about it as well.